And so the LIPS doctors now support the organization, go on trips with the organization, are visiting professors for the organization. And I want to give you just a little insight into the kind of work that we do, the involvement with Long Island Plastic Surgical Group. And I'm doing this just through a trip I made in April of this year to India. So a little bit about the organization. One of the issues in the developing world is there's a lack of access to surgical care. Many of our patients that I'm operating on will walk or take buses or spend their life savings just to go 3 or 4 days to get to a place where the surgery can be done. A lot of times in these places there are no surgeons who are capable, there are no plastic surgeons, and it's kind of different. When you're sick here today, if you have cancer, you go to the hospital and you get treated. And if you have an issue with a cleft palate, for example, which we do a lot of, or a burn, or any of these plastic surgical issues, you can't just go to the hospital. Either there's no hospital in town, there's no plastic surgeon in town, or you can't afford it. Which, it's kind of one of the biggest tragedies in plastic surgery, because a lot of times a cleft lip takes me 45 minutes. If you're old enough, I can do it under local. And people say, no, it's a life-changing procedure when you do something like that. When you see it, when you actually do it, and you realize when you talk to the patient, it's actually not just a life-changing, it's a life-making procedure. These are patients who have a very small defect in terms of the amount of surgery that needs to be done. But the life impact is tremendous because they tell you they can't get married, they can't get a job. There are a lot of stigma associated with having a cleft lip, for example. So they don't have a life. They live outside of town, and there's all these kind of myths in some of these countries where they think one of the reasons you get a cleft lip is because you see somebody with a cleft lip when you're pregnant. So they don't want these people around. In some countries, they also think that, you know, part of what happens to you in your life is the way you've acted, and they think that somehow this bad thing that has happened to you has some kind of bearing on who you've been. So patients who have horrible burns, you know, their hands are burned shut, and they can't get a job because you know they need to have their hands to do most work in these countries, or their arms are stuck at their sides, or their arms are stuck down, or people just don't want them around because they're disfigured. So they have a lot of issues surrounding in plastic surgery in particular. And why is that? Because it's something that we could actually make an impact on. Cancer is very, very hard. You need an intensive care unit. You need to be there months and months and months. With plastic surgery, we can go in, we can do the surgery, we can take care of the issue, and then it's done. And that's why what we do has a very, very high impact in terms of its cost effectiveness. So we have, and I'm going to go a little bit more about what we do with ReSurge, but they've even taken it steps and steps beyond that.